Away from that, the Kenya National Union of Nurses and Kenya Union of Clinical Officers Nairobi branch now want the Nairobi Metropolitan Services to absorb the contracted staff to permanent and pensionable scheme, saying the workers have stagnated in one job group for the last 10 years. The health workers who held peaceful demonstrations outside Nairobi Metropolitan Services (NMS) offices further demanded immediate resignation of the Director, Lieutenant General Mohammed and Human Resource Manager Kibet.
Led by the Kenya Union of Nurses Nairobi Secretary Owas Onchari, the group of health workers marched towards the NMS offices in a peaceful demonstration, demanding for resignation of their bosses.
Indeed, these guys were employed by NMS through Public Service Commission, and the same employer gives a notice. Why is NMS not implementing the same notice that PSC gave? That is why we are saying, if we transit to the county, the employer will be at liberty to either absorb these guys upon expiry of that contract or dismiss them. And that will, under the law, under the labor laws, will not be right.
According to Onchari, some staff who were employed under a 3 years contract have stagnated under one job group since 2010.
Members will be having letters. We are not asking much. We're just asking the DG to honor his word and give these members their letters so that we go back to work. In fact, we don't like striking. We don't like picketing. We don't like demonstrating. We like discharging our duties as well-trained. So, atupatie barua zetu, as said, in 2 weeks' time, we have no problem. We'll go back to work and work.
Tom Nyakaba, the Kenya Union of Clinical Officers Nairobi Secretary, affirmed that the group has held talks with Major General Badi several times, but the demands are yet to be met.
The group of health workers under the NMS have threatened to continue holding a series of demonstrations until all their demands are met, as they even continue to paralyze their services and calling for immediate resignation of the Director General of Health and the Human Resource.
Frederick Muki for Lunchtime News.